Greetings. This month, the spotlight is on women's health. And although I've, in the Unwounded Womb series, which is the collection that the Apprentice Lounge has full access to, has a piece on estrogen. Today, I'm going to speak about estrogen dominance, and also so that all the members of the Wellness Hub can have access to this information as well. So let's start off with the big picture before we dive into the nitty-gritty. So estrogen dominance is an unspoken and silent pandemic of the 21st century, right? It is so big. It's a global pandemic, in fact. And it doesn't only affect women, but it affects men. And it doesn't only affect humans, but it affects the entire ecosystem. Estrogen dominance is so significant on the planet at the moment that that a whole range of animals are having changes in their hormonal profile. Right? This is so significant that the weight of testicles of alligators in swamps is getting lighter, right? Alligator testicles are getting smaller as estrogen is getting higher on the planet. Not only that, but the equivalent of the menstrual cycle of shellfish is interrupted because our entire planet is awash in estrogen. It's not actually awash just in estrogen, however. Yes, the oral contraceptive pill and the way in which this is stable as it passes through women's bodies and out through their urine then can affect everything that water comes in contact with. But on top of that, there's this enormous burden that is toxicological waste, pervasive organic pollutants, right, that behave oh so tragically like estrogen, right? And so it's affecting all life on the planet. And there's heartache in this, obviously, for all of us, right? There's heartache for the alligators. There's heartache for the men with prostate cancer. There's heartache for the men with estrogen-mediated obesity. There's heartache for the men with erectile dysfunction, right? There's heartache for the men with depression. And there's heartache for women, obviously. I'm going to focus today on female symptoms here and the feminine experience of estrogen dominance. But before I dive into that, I think it's really important to see that there are transpersonal drivers, global drivers, that women are, in their experience of estrogen dominance, are canaries in the mine shaft, perhaps, that they are experiencing the symptoms of I'm careful with my language here, but what I want to say is the rape of Gaia, the pollution and pain of Mother Earth, right? And so experiences that may seem that are very personal and individual are taking place inside a much larger pattern. And a large part of that experience is psycho-emotional, right? Because hormones are molecules of emotion. So it's not just that we have a Gaian hormonal imbalance, but also that there is a global and Gaian change in in soul, change in psyche, right? So there's a large number of the symptoms of estrogen dominance that are really soulful and psychic experiences. And these will be generally interpreted inside the context of your own life, right? As is appropriate. But it's also really important to see the struggles of your health, the struggles of your hormonal health, the struggles of your own psyche inside this much larger picture of the struggles of Mother Earth. So yes, our mothers are struggling. Yes, our daughters are struggling. Yes, our baby girls are struggling, right? But so is everything else. It's all struggling. Men are struggling with estrogen dominance too, right? So I think that's an important precursor before we jump into the female experience of it, to contextualize it, because it's very important to personalize our health and see the unique and individual journey and significance and meaning behind our healthcare challenges. But it's also very important to see the transpersonal drivers of those things that we should not just take personally. That's why a lot of people are drawn to a language like astrology, because it takes it out of just me and sees it inside the larger cosmic forces that are at play, right? And so I would like to be able to have that backdrop of the larger Gaian forces that are at play whilst we dive into the pictures here of estrogen dominance and how that's experienced by women. Firstly, how big of a problem is it for women? Big. It's a big problem, right? Yes, at least two-thirds of breast cancer is estrogen dominant, right? Okay, so that's huge. But we also have that going down the line, so that there is, I think I saw a heartbreaking statistic that said that that in some populations, there rather than 1 in 10,000 or 1 in 100,000, that the number of little girls who start showing signs of menstruation under the age of 5 years of old is 1 in 100, 1%, right? And that's risen starkly and sharply over the last 4 decades. Right? So it's starting all the way through. In fact, it's being experienced in utero. And whatever you experienced, if you're here in my inner circle or apprentice lounge or wellness hub, whatever you experienced in utero is different to what my daughter experienced in utero, who's now 14 years old, and is different again from what a baby, a small fetus, is experiencing in utero today in 2023, right? So this experience is going all the way through, and it's changing psyche and it's changing soma, right? It's changing mind and it's changing body, right? And these changes are vast. They're so vast. It's like having LSD in the water supply. Doesn't mean it's bad necessarily, but it does mean that it's going to have significant changes on how we see ourselves, how genders identify, and how reproduction and consciousness all unfold. So let's list off some of the most common experiences of estrogen dominance, so that you can start to work up a picture here. Now, before I do this, I want to say that really an invaluable tool that you lean heavily on in clinic in this arena is integrative path testing, where we look at estrogen profiling and metabolism. And really the best one of those is called a Dutch test, And I do it alongside looking at androgens and cortisols and progesterones and melatonin and a whole range of the hormonal cascade, right? So that profiling is really, really, really helpful here. But even without it, with just a clinical evaluation, we can see whether someone's likely to be suffering from estrogen dominance. So let's start off early in the journey and look at the experience of children and younger women. So I mentioned an average shortening of menarche, right? Of the time of when period is beginning. And that's getting earlier and earlier and earlier and earlier. So that's happening. So that's an experience that our youth are having today. But it doesn't start there. It can commence much earlier before menarche arrives with estrogen dominance in terms of symptoms like weight gain. So we know that in Australia, I think we're currently at around 2/3 to 70% of the population that are overweight or obese. And that in the next 5 to 10 years, that's going to hit 80% of the population. And we're seeing that really affect our youth and our kids. But it's not always a problem of calories in and calories out. A significant number of this is through what are also termed obesogens, which are xeno-estrogens or other pollutants that cause weight gain. In this instance, the xeno-estrogens in primary school girls can drive unhealthy weight gain, right? We're not speaking about the beautiful spectrum of human bodies that are healthy and gorgeous, some that are lean, some that are curvy, some that are hard, some that are soft. I'm not speaking about this. We're speaking about unhealthy pathological weight gain that is going to cause physiological problems, right? And so this is starting in our young girls, right? In addition to that, we are also seeing an increase in anxiety. Okay, so we're seeing this sharp increase in female anxiety, in global anxiety, but in women, we're seeing a sharp increase in anxiety. Now, women have always been skewed more towards anxiety than men, right? So anxiety is because of estrogen and a range of other factors and testosterone. There's a biological lean towards anxiety in women, but that lean is getting stronger and stronger, and it is really affecting our young generation. And a significant amount of anxiety is bound up in non-psychological triggers. And the triggers are hormonal triggers of really high levels of estrogen. And so that means that a large amount of anxiety, when we look at the timeline of it and when studies are done to this effect, starts in women within 12 months of their period commencing. Why? Because in addition to all the xenoestrogens that they're exposed to, then their body, their ovaries start producing endogenous estrogens. And those estrogens then, when it's really, really high like this, then gives rise to a fight-flight response. And for a range of people, that fight-flight response is a flight response, is an anxiety response. So estrogen can be associated with aggressive behavior and is associated with aggressive behavior. It can give the fight side of the fight-flight response. But it's in relation to anxiety, it's really, really tightly coupled with the hormonal flux of the beginning of young womanhood, with the menarche. There's another peak that happens in anxiety in women that's more like around the age of 19 or 20. There's a second peak that happens there as well. But anxiety is definitely correlating very strongly with estrogen dominance. Another thing that couples really strongly with estrogen dominance is self-harm. So it's important for us to see the sociological drivers of teenage angst and female self-harm, which are all rising very strongly. As a father of a 14-year-old girl, I'm deeply, deeply exposed to this through my daughter and all of her friends, right? It's heartbreaking. Yes, it's connected to social media use. Yes, it's connected to terrible gender depictions of body and other things that we've been wrestling with for quite a long period of time. But on top of that, it's also strongly coupled with estrogen dominance, right? So estrogen dominance can also give rise to self-harm, suicidal ideation, anxiety, and depression. And then with this backdrop then of estrogen dominance, then some of these young women, some of these teen girls are also, without estrogen dominance, then at a higher risk of tic-like disorders, of things like Tourette's, functionally acquired tic disorders. And if you haven't encountered this, then search TikTok Tourette's or search tics or cooking breakfast with Tourette's on the internet, and you'll see that it's not just Billie Eilish. There's this incredible wave of young women that have just spiked since COVID. This is very fresh, spiked since COVID. And it is social media is the main trigger for this. It's not Tourette's, it's Tourette's-like. But there are a range of risk factors that appear to make our young teenage girls more likely to develop these tics and these strange Tourette's-like gestures that come out, right? Saying socially inappropriate things, hitting themselves on the head, a whole bunch of stuff like this. Now, estrogen dominance is not the only one. Trauma is another one. Neurodivergence is another one. There's a range of precursors that can give rise to our teenage girls being more vulnerable to these kinds of quite significant and very recent changes, right, that have gone through like this. So, but estrogen dominance is one of them. Okay, so then let's keep moving along with this. I'm going to foolishly or bravely try and list as many of the things that I can here, and I would really ask you to be gentle with me and to not take offense when I'm attempting to avoid offense in this conversation very deeply, right? Another issue that is happening is that we're having larger breasts develop in our teenage girls, right? So in addition to weight gain overall, we're also seeing larger breasts. And you may have heard of this or encountered this. It's happening in teenage boys as well, gynecomastia. It's happening in boys as well. And then it's giving rise to already an increase in breast reduction surgeries for women that have very painful backs or have or find it impossible to run because they have such large breasts. Now, large breasts are wonderful and beautiful and natural and good, right? But if they're being determined by toxic exposure and that's causing pain, psychological or physiological pain, then we need to be able to speak about this as well, right? Maybe you've heard about this with the estrogens that are inside factory farm chicken, right? And the way in which that can give rise to breast development in teenage boys and weight gain in teenage boys, or more significant breast development in our young girls, right? So these are a couple of them. Also, we're seeing shorter menstrual cycles, right? Shorter menstrual cycles. Menstrual cycles of 18, 19, 20, 21 days. in a whole range of teenage girls. And the clients that I see that have this report that it is exhausting, and it also can give rise to anemia and difficulties in maintaining adequate iron levels, and also just the coming around every 3 weeks or less. I have a client where it comes around every 17 days, the poor little darling. Every 17 days, she has a menstrual cycle, and it's filled with pain and discomfort, and she has to not go to school. And when tested, her estrogen markers and metabolites are just off the charts, right? And so this is something that can correct and come back to a normal spectrum of a kind of lunar kind of cycle that's somewhere closer to 28 days, a little bit longer, a little bit shorter, but certainly not less than 3 weeks. So the length of the cycle is one of the things that we're seeing. We're also seeing the number of young women who have debilitatingly painful periods going up, right? And so that is also a symptom of estrogen dominance and the pollutants in the world that are impeding the liver's ability to break down those estrogens. So then you have all of that pain, all of that cramping, at times, like vomiting and losing consciousness because the estrogen is so high. Right? Let's continue. Is there anything more at that early end of the spectrum that is worth speaking about? I think now we'll just move on to women in general, and most of the things that I say here can also apply to teen girls as well. Maybe not all of them, but most of them. So experiences that are also commonly estrogen mediated are really tender, painful, lumpy, or cystic breasts. So yes, high estrogens, high exposure to xenoestrogens, and a poor capacity to break down your own estrogens is giving rise to breast cancer in women, but it also gives rise to cystic breasts, non-cancerous lumpy breasts, and they can be exquisitely painful. Something that I have not experienced, obviously, as a man, but having heard the heartache attached with it, it means that for some women, having a hug is really frequently very, very painful. And that just hits me in the heart there, right? That they want to hug whilst being covered because it's so painful. The smallest touch and pressure on their breasts is really painful. Now, obviously, that's going to be worse at particular points in the cycle. On that note, when I say that, then you're going to say, oh yes, it'll be worse coming up to the period, right? It'll be worse in the second half of the period and in that PMS window, right? On a 28-day cycle, maybe from day 24 or 25. Yes, and because of the way in which estrogen moves through the cycle, it can also happen at ovulation. And so tender breasts, more lumpy breasts, and all of the experiences of premenstrual tension or premenstrual dysphoria, right, can also be experienced at ovulation, just before and during ovulation. And in some women, it's worse. Their physiological experience is worse at ovulation than it is prior to menstruation, right? And that's rough. The women that have shared this with me have said how painful it is because that ovulatory spike should be this time of higher energy, higher socialization, higher activity, higher motivation, higher lust for life. I can do it. I can do it. Yes. It's not just about fertility and libido, it's about libido in its broadest sense, lust for life, right? And when that period of the cycle becomes associated with pain and tenderness, then there's a lot of troubles there as well, right? And so if you are struggling at ovulation, it may not be anything to do with follicle stimulating hormone or ovulation as such. It is commonly a symptom of estrogen. And one of the symptoms that can happen there is cyclic fight or flight response. So getting, I've spoken of anxiety more strongly before, so let's speak about fight response. Having more discord and more intersocial and interrelational, interpersonal problems around the period of ovulation and in the lead up to menstruation, right? And that is a fight response. And in some women, it starts just prior to ovulation and it does not ease off until menstruation. And so that means they have an experience of PMS, right, that lasts for half of their month, every month. And if that month is actually a 17-day cycle, then it means that they're, you know, like their month is filled with dysphoria, aggression, short-temperedness, impatience, a whole range of really hard experiences that cause a whole bunch of different problems, right? And so that fight response. And for those that are interested as well, then there's a correlation, there's a tight coupling there between what happens with estrogen and what happens with histamine. And so estrogen can also cause histamine in the brain to increase. And then when the combination of them are there, then you have definitely a strong stimulus of the fight-flight response. And again, for some women, that could be experienced as anxiety, and for some women, that could be experienced as adversity, right? Okay, so the next one is, what will be the next one? Endometriosis, right? Endometriosis is shockingly common now. And the mainstream orthodox medicine doesn't treat it very well, doesn't even necessarily diagnose it very well a lot of the time, right? And endometriosis is an estrogen dominant condition. I think always. I think I could be mistaken, but if you have endometriosis, then I believe that means you have a problem with estrogen metabolism, right? And so it's because estrogen is what is signaling the thickening of your endometrium, the lining of your womb. And when there's too much of it, then that signal just says, yes, yes, more endometrium, until the endometrium then ends up not just inside the womb, but on top of the womb, around the ovaries, on the bowel, on the intestines, on all of this area down here, right? And then when that contractions and all that processes happening of menstruation, then the pain is really significant, and also there can be problems with fertility, right? And so that's an estrogen dominant condition, and it's not treated just through surgery. It must be treated through helping with the manner in which estrogen is metabolized fundamentally. And so if surgery is required, then surgery is required or elected. But either way, we need to be able to support this at its root. Another one that is really common is bloating. Now, here what I'm speaking about is not intestinal bloating with gas, right? You need to go and pass wind, and it feels like it's in your large intestine or stomach. I'm talking about bloating that is puffiness, distension, looks like weight gain, fluid retention kind of bloating, right? And so a significant number of women will report bloating that is going through their cycle now as well. And that distended feeling is also a symptom of the liver straining underneath too much estrogen, right? Weight gain, I've spoken of weight gain. Now, the tragic thing about weight gain and estrogen is that estrogen signals for adiposity, for softness. It takes the kind of androgynous prepubescent female body and lays down extra softness and curves generally, right? And then that fat tissue, that adiposity, then behaves like a full body third ovary in men and in women. Fat cells are like little ovaries and they produce more estrogen. So if your estrogen is high and it signals for weight gain and you get weight gain, then that weight gain is going to signal for more estrogen, which is going to give rise to more weight gain in this instance. So weight gain can be very much determined by estrogen dominance, right? And have nothing to do with what you're eating. You're like, hey, I have a lettuce leaf each day and I exercise, and it's not working, right? In this instance, it's estrogen dominance. Some others, headaches. You know, the headache before the period piece? This can also be headache throughout the entire cycle. It's in the same way that you get a headache when your liver is poisoned with alcohol and you have a hangover, you get a headache when your liver is poisoned with too much estrogen, right? There's too much estrogen and it's just like, and it's struggling underneath that burden to try to break it all down and process it. And it can't, and it gives rise to headaches. So headaches are also common symptoms of estrogen dominance. A couple more. Low libido. This is a strange one because in menopause, we have low estrogen and then low libido, right? But so you may think of low estrogen as being associated with low libido because of the experience, the menopausal experience. And that's a whole other kettle of fish, and we'll speak about that, or I have spoken about that previously. It's a different piece. In menopause, estrogen is low, right? But throughout the rest of a woman's life, the more common thing than low estrogen, more common but not unheard of, is high estrogen. And that high estrogen can also produce lower libido. One of the ways in which it does this is that estrogen and progesterone have their own balance, right? So estrogen dominance is when there's too much estrogen, right? But because they have this reciprocal relationship, really high estrogen can also prevent progesterone from doing what it really needs to do as well. And so in that instance, yes, applying your wild yam creams and things like this to try and boost progesterone may provide some help, but it's not enough, because you really, at the same time as boosting progesterone, if you've been diagnosed with low progesterone, you really need to help metabolize estrogen is the most likely pattern that's happening, especially if you see I'm ticking a lot of these boxes, right? If you're ticking a lot of these boxes, not all of them, no one will tick all of them, but if you're ticking a lot of these boxes, then the chances are this is you. And rather than just boosting your progesterone for fertility and libido, then you want to boost your progesterone and help metabolize your estrogen there. Okay, now this is a little bit more technical than I was expecting to be today. So I think perhaps what I'll do is jump into a conversation with Tara so that we can make sure that this stays really alive and relevant. And wonderfully and appropriately, Tara is a sacred womb bearer, so she can give voice to the female experience on this side as well. So Tara, that was a lot of technical details there. I remind you we started with the transpersonal, went into the young experience, and then I listed a bunch of clinical things here as well about estrogen dominance. What I haven't gone into is solutions for this. It's its own whole piece, and we can go there. But first off, I'd like to hear from you. Thoughts, inspirations, questions, pushback, you know, how did that land?
Yeah, I look, there's a lot of information there, but a lot of things making a lot of sense. And yeah, quite horrifying to hear that young girls are starting to have their periods at 5. Like, that's just mind-blowing to me.
Yes.
Yeah, I think the piece that I would love to hear a little bit of elaboration on is around that 1920, where there's another sort of boost where they go into that like more anxiety and so forth, because I've got young daughters that are hitting that age now. And
Yes.
yeah, I'd like to understand what actually
Yeah.
creates that peak.
Okay. Yeah, me too. Me too. I'm not so firstly I want to say I don't know. The
Hmm.
clustering and arc is quite clear and it's well commented on. I have seen in the research there's another spike in emergence. So you could have no anxiety emerging at menarche
Hmm.
and then it emerging around the age of 19 in women, right? And so firstly, there's not going to be a single driver of this. There can be sociological, economic, psychological drivers that are very relevant at 19. And so I'm not going to speak to that. And I've already said I don't know. But I will explain how that it can be, there can be a biological driver of that as well, and how that would be. And so because estrogen itself and poisons at large, including xenoestrogens, must be metabolized by the liver, right? So all of our hormones, male hormones, female hormones, must be metabolized by the liver. All of our drugs, coffee, alcohol, everything must be metabolized by the liver, right? Actually, everything is kind of metabolized by the liver in some way, right? And one of the things is the normal metabolite, the breakdown, the changing of estrogen, so it can be excreted and out it goes out of the body after it's done its job, right? And that needs to happen on the daily. Now, the longer you live, the more burdened your liver becomes, unless you're really engaged in flushing and cleaning your liver on the regular. And and if then as well, at the age of 19, you have had 5 years of exposure to teen binge drinking, for example,
Mm.
and drugs and coffee and energy drinks. And also you've been in a fight flight response going through your high school graduation and not in a feed and breed response where metabolism takes place and hormonal regulation takes place. All of those things are going to make it harder to break down estrogen, right? And it could be that it just catches up with some women at that point because of, and again, in one 19-year-old girl, it could be because she's been in a fight flight response through bullying and hard work and shitty things throughout all of high school. And it's a fight flight rather than a feed breed response. And that produces its own anxiety, the fight flight response, but it also suppresses metabolism and then estrogen climbs. And then that's how the estrogen could be involved at age 19. In another teen girl, it could be because she's been drinking and smoking and energy drinks and destroying her liver like that. In another, it could be because she's a good, clean, country living girl in an environment like where I live here, and she has high exposure to agricultural poisons. She lives on a
Mm.
farm, and there's glyphosates and things like this. And she's not drinking and she's not traumatized, but her liver is still just getting whacked with all of these things, right?
Mm.
And it one of the things that it could be getting whacked with, if it's not coffee and alcohol, is paracetamol. So perhaps she's had, or ibuprofen. perhaps she's had moderate menstrual pain, but in order to be able to go and work at McDonald's and go to maths class and just stay in the world, because we don't have a same culture of red tent sanctity around, you just go away and be with your womb, then she's been using ibuprofen and paracetamol. Those whack the liver as well. And in whacking the liver, then the liver is more burdened and toxic, and its capacity to break down estrogen is then further reduced. So it can be a whole range of things from the estrogen hypothesis, right? Which is not going to say, I'm not saying that all anxiety is estrogen mediated, and I'm not saying that anyone who develops anxiety around the time of their period is necessarily that, because it could be like, well, she developed anxiety at the time of her period after a horrendous car crash and lots of bullying, and we profiled her estrogen levels and they were completely fine, right? So I'm not making that statement. I'm just saying that it is central, right? And so that's one way in which it could take a while to catch up, right? Is that those poisons, those pollutants, those toxicological and metabolic burdens have just accumulated and accumulated and accumulated. And teenagers have a desire for comfort, and they eat shit of food a lot of the time. And that shit food places a burden on the liver as well, right? So all of those things, can also be involved. So with a 19-year-old developing anxiety, then of course with everything else, you need to go through a whole process of inquiry and differential diagnosis. Is it anxiety because mum's hitting you every night? Okay, well we don't need to go too much further at that point, right? Your home's a war zone. We want to look at the psychological determinants of it. Are they really, really prevalent, right? Even if they are prevalent, it doesn't mean there's not biological drivers that are reducing her capacity to be able to engage fruitfully with those challenges that she experiences, right? And then I guess three biological lenses that are very relevant at 19 is it a histamine thing? And estrogen levels are normal, but histamine is not being metabolized and broken down, and that's causing anxiety? Then I'd see a different series of pictures rather than tender boobs and stuff like that, right? Is it an adrenal thing? And is it because for whatever reason, she's been in fight, flight, and that's the anxiety, and it's adrenal thing, right? High cortisol, or tragically at that age, lower cortisol, which should be higher cortisol when you're only 19, right? But is it an adrenal thing from an embodied physiological side, right? And then the third one is it a liver thing, right? Is it the liver's inability to break down estrogen and toxins and all these other sorts of things as well? And if so, why? So you have to go through this process of problem solving it. But right now I'm just saying how commonly when I do send it, and this is the most common path test that I send for, is hormonal profiling in men and in women, right? It's the same test, exactly the same test, and it's looking at a whole range of them, and estrogen dominance is just so common, right? Yeah. And for what it's worth, I have one of those tests on my table out here right now for my daughter to use, so that I can get her profile to see, is this one of the things that's at play in some of her challenges? And if it's not, great, tick the box, support her in other ways. If it is, I really want to make sure that she has all the biological support to be able to navigate the psychological realm of being a young woman, being a soul, being human, and going through high school and all of these changes, right? So it's not I'm not reducing anxiety to the biological here, but I am shining a spotlight on it to say talk therapy alone is not enough when it has a strong biological determinant. And so in that case, like, they're doing lots of counseling, because it's anxiety, it must be psychological. Let's talk about it. Oh no, actually, turns out someone's put LSD in your water supply. How much talking is going to get you through that? It's not going to work. right? Suddenly reduce the histamines in their diet, and the anxiety is largely resolved. Even if they inevitably tell a story about what they're anxious about.
Mm.
And so this is a really important one, is that if you are in a happy place and I sneak up behind you and I hit you with an EpiPen to inject adrenaline into you so that you get a fight-flight response, as your heart rate increases and you go into that fight-flight response, then the brain will do, the mind will do what it's supposed to do and try to make sense of this. It says, I'm in a fight-flight response. I'm in a fight-flight response. Why is that? Oh, shit. Why is it? And then the brain looks at all the little stressful things that it has on the table. It's probably that test that I've got tomorrow. Or, it's probably that conversation I had with mum last night. Yeah, the thing with the mum. And then the brain grabs a hold of it and turns it around and around and around. Now, that thing was stressful. But in this moment, it was actually villainous Jimmy who snuck up and injected them with fear, with an EpiPen. And so despite them saying, I'm scared of this, I'm scared of that, I'm wondering, despite them having that experience, it doesn't rule out in that instance that someone snuck up and put LSD down your collar or hit you with an EpiPen, right? And so those examples are just examples of the way in which biological things can then be sense made by the brain at times, and we don't need to resolve it at the level of mind. We just need to get the LSD out of the water supply, and then you're well equipped to be able to resolve that at that point. So when we reduce the histamine, or when we reduce the estrogen, when we balance the adrenals and the cortisol response in those things, right? When you get you off the 7 Red Bulls that you have before lunch, the anxiety disappears without any psychotherapy in that instance. Yeah, in that instance. Yeah. Okay, good. So that's how was that?
Yeah, that was amazing. Thank you.
Okay, good. Yeah, we went through a few different rabbit holes with that one. Okay, so how about do you have any other questions, comments, or queries about this larger piece of what I've shared today?
There is one question in relation to when women are going into menopause and their estrogen levels are dropping naturally. Is there an impact on these higher levels of estrogen that is in our environment? Like, is it then impacting on women that are in menopause that it would be having a higher level?
Yeah, good question. Because I mean, yes, because breast cancer is still high.
Okay.
Right? So we're still seeing high breast cancer from these forms of estrogen that are either not broken down. Estradiol is the form. There's forms of estrogen like estriol that are protective against breast cancer, really positive. And there's forms of estrogen that are determinant of breast cancer, right? So like more toxic, proliferative, oncogenic forms. And a range of the toxins that we encounter behave like that first form, the cancer form of it, the bad girl of the estrogen 3 sisters. So yes, having that backdrop in the same way that it is for men, right, who are not going through menopause in the same way, and they will have estrogen come up, further lower their testosterone, which is already going down, and then give rise to prostate cancer, weight gain, changes in mood, getting grumpy, getting less generous, grumpy old man syndrome, and all of these things, right? That happens as testosterone goes down and estrogen goes up. Does very bad things for for men, makes them not pleasant to be around when that happens. Then I think that there are still risk factors from those xenoestrogens that are flowing through the system. But despite that, the menopausal and perimenopausal women still require the real archetypal sacred essence of biologically produced estrogen, the good stuff in the good dose, which when their ovaries wisely say, okay, that's enough, we've got to drop these levels, otherwise you're going to have cancer and all sorts of problems, right? So the female bodies, it goes up as high as it possibly can from age, let's say 13 to 50, right? And then menopause comes along and says, okay, that's enough. We've got to drop that down. And when at the start we put hormone replacement therapy and said, no, let's keep those levels high. Let's keep those levels high. Let's just cruise through menopause without that big shift. What happened? Cancer. Cancer is what happened. We need estrogen to drop at that time. But the dose of estrogen that is required and the estrogen that is produced has to come from the adrenals in menopause. And so the adrenals are what are drip feeding in that good estrogen so that you can not have all of the dryness of eyes and mouth and skin and scalp and nervous system and vulva that happens when estrogen is too low there. And so, yeah, I mean, your question is a really good one because I think that we can end up with the worst of both worlds there in menopause, where you have still the risk of xenoestrogen mediated cancer, whilst at the same time having all the tragedies of not enough of the good estrogens produced by your adrenal glands. And if instead you arrive at menopause with good adrenal glands, then all of those hot, flushy, dry, difficult psycho-emotional roller coasters will be much, much milder to non-existent. For example, Japanese women have just not really experienced menopause as it is spoken of in the West, right? It's just not an Asian experience so much, right? It's just like, that's not us. Yeah, it stops, it changes, but it's not a big, it's not so uncomfortable, right? And it shouldn't be. And one of the pieces here is it will be less uncomfortable if your kidney chi is intact, if your deep kidney yin is intact, if your cortisol levels in your adrenals are intact, right? So you have that good estrogen. But yeah, as to your question, I think you very much can still have the worst of both worlds when you arrive there. High cancer risk from it not being metabolized, and yet low estrogen levels because the adrenals are shot and they can't drip feed the amount that you require. Yeah.
Thank you.
Yes. Okay. Thank you for your contribution. This was a little bit of a deeper dive than I expected to go into today. But I hope that the tools and the tricks and those big symptoms that I spoke of, and I'm just going to list them off quickly, just in one little strip here so that they can be repeated without going back. A range of the symptoms to look out for are tender, cystic, lumpy breasts, cyclic headaches that come either at ovulation or at menstruation, like before menstruation, or the cyclic fight-flight response and cyclic dysphoria, right, that happens in a regular cycle, wherever it is, again, ovulation and menstruation, low libido, bloating and fluid retention, headaches, weight gain, clotted menstrual blood, short cycles. Yeah, these are some of the main symptoms that come to mind. And if you experience several of these symptoms, then I recommend you don't go to a GP and get a blood test. Those things are actually quite useless. You look for an integrative GP or someone such as myself that does integrative path testing, so you can get the proper cascade done through a dried urine metabolic profile of your estrogen levels, and then we can see exactly which of those pathways are needed to be able to help support your body, whether it's a methylation and genomic kind of picture or a liver mediated picture, and that will help it to break down. Okay, bless you, sweet friends. Type your questions in below, as always.